All right, there we go. Good evening, everybody. Tonight, everybody, welcome to Friday of the 3rd of April already. Uh, Live update with Council President Brandon Scott. Tonight, we are being joined by a special guest, uh, none other than Ricarra Jones, Miss Ricarra Jones from 1199 SEIU for the DC and Maryland region. As you know, 1199 represents our healthcare workers who are on the front lines of COVID-19. So I'm so excited to have Ricarra with us tonight to get some insight on how our healthcare workers are holding up, but also what they need from us and what kind of advice they have for us as we continuously are experiencing this COVID-19 pandemic. So welcome, Ricardo. Thank you for joining us this evening.
Yeah, no, so thank you for having me.
Good. So thank you for joining us. Before we turn it over to Ricardo for a second, just wanted to give you guys the latest stats really quickly. We are now up to 2,758 cases of COVID-19 in Maryland. We are at 313 for Baltimore City. So, Ricardo, I'm going to turn it over for you for a second. Just give a intro of yourself, who you are, talk about the mission of 1199, and just talk about the good work that your workers do every day.
Yeah, so first, thank you, Council President Scott, for hosting these informative town halls. I've tuned in, my members have tuned in on a regular basis. So it's always good to be able to access this type of information and get this information from you in such a time where we're all trying to figure out what's going on. So I just want to thank you, one, for having me on here, and then for two, always providing these updates for folks when they're really in need. So I'm the political director with 1199 SEIU. We are the largest healthcare union in the country. And we represent workers, frontline healthcare workers in hospitals and nursing homes across the state of Maryland. And some of our members, we have a range of titles. So we have nurses aides, techs, lab workers, housekeepers, dietary workers, pharmacists. We have a whole range of workers who are currently on the front lines in most of our institutions. So as you can imagine, our members are, they're always going to provide, quality healthcare, but they're nervous, they're scared. These are very uncertain times, and they're doing their best to provide care for our patients, but also for themselves and their families. So it's just a time when they are trying to figure out, there's a shortage, as everybody knows, of PPE, which is personal protection equipment. This is a nationwide shortage. There are folks who are using, in some places, garbage bags, right, to protect their clothing. And there's a high need of masks and gloves. Any type of personal protection equipment is the main thing that our members right now are being faced with, because it's such a shortage, and they want to be able, at the end of their shifts, they also want to be able to go back to their homes and to their loved ones at the end of the day. So it's uncertain times for us all, but our members are, they're showing up every day, and they're, still doing their jobs and still sticking to their mission.
Yeah, Ricardo, and that's what I want to talk about a little more. Talk about some of the stories that you've heard from some of your members about the experience of some of them maybe not even able to go home and be with their own families. Can you talk about that for a second?
I mean, it's so far ranging. Some of the, on one end, I'll say some of the most disturbing stories are that they're finding out that they've been treating patients who are tested positive for COVID-19 from the media. So unfortunately, there's been a lack of communication in some of the institutions about like who's tested positive, if they're treating folks that are positive. And I think for them, that's one of the things it's very scary, because, you're treating one patient and you don't know if they've tested positive or not. So, and they're still trying to provide care, but just that's one of the stories that we hear the most, is that they wish that there was improved communication about the actual number of positive cases. And then there's just been, while some institutions have slowed, we know that social distancing, we know the 6-foot rule, right? And to limit groups of 10, some institutions have been slow to limit outside visitors, folks coming in that probably don't necessarily need to be in some of these institutions that are exposing people. So most of the experiences that they're having is we're really trying to work with some of these institutions to just put some parameters in place that will protect them and protect the residents and the patients.
Yeah, and I think that that's important. That's why it's always important for everyone. That's why we try to get folks that are right on the front lines to hear you guys, because that's how you guys as citizens can also help us advocate for these individuals who are literally risking their lives so that they can care for our loved ones. And can you talk about how this has impacted? Has it had an impact on some of your members as of your members contracting COVID, or have we been lucky in that standpoint?
No, unfortunately, we have had quite a few members that have tested positive recently. And I mean, and unfortunately, we've also had issues where even though there were positive cases in some institutions, they weren't able to have access to testing. So even though they were required to treat patients that have tested positive, they were not able to be tested themselves. We are working very diligently to change that and to require that if you've had contact with a person that's tested positive, that you also have the opportunity to be tested. And then because it's such a dire situation, we've also had some situations where our members are helping patients who are sharing ventilators. I don't know if you guys have heard these stories, but there's multiple people, there's a shortage of ventilators. So they're trying to help patients as much as they can, but they're in a situation where they're sharing ventilators. So we are constantly advocating for folks to be able to have access to testing, to have transport. People don't think about this, but have transportation to get to testing, right? So testing may be available, but you have no way to get there. Another major issue that our members are dealing with on the side of trying to make it safer for public, there's a lot of public transportation that's been shut down, service line closures or cuts. But a lot of our members depend on public transportation to get back and forth from their facilities. So that has been a major issue. And we understand the need to do that, but it's caused a lot of our members to either one, show up late or have very difficult situations in trying to actually get to work because they truly depend and rely on public transportation every day to get to their jobs.
Yeah, and Ricarra, if you could say to the average citizen, and everyone, if you have questions, be sure to, as always, start to send those in. You have an expert, someone who represents and works with the people that are taking care of everyone that's gets sick in our city consistently, but especially during this crisis. Be sure to send that in so that we can answer your questions. But Ricarra, a lot of the things that we get from people here each and every day is some people don't think this is that serious, and when are we going to be able to go outside, or why can't I go visit my grandmother, or why can't I go visit this person? From someone who's on the front lines, what would you say to people who ask those kind of questions?
I'll just say that our members say constantly, this is not the time you want to be in a hospital. This is not a time that you want to have to show up to any type of emergency room or take any type of unneeded services, because the hospitals are overwhelmed. They are short on beds, they are short on equipment. So this is not, you don't want to take the chance. If you don't need to do something, please don't do it. Please be safe. Stay at home as much as you can. We know that there are essential workers. Our workers are essential, right? So they have to be out. But if you don't have to, don't do it, because there is such a shortage right now. And our workers are working double shifts, sometimes triple shifts. They are overworked. And this is just not a time that you want to take a chance to be in any type of facility at this time. So we're asking that you, help those frontline workers by staying at home and doing your part. They're out there doing their part. They're going to work. They're showing up. They're trying to, provide care. And we're asking everybody else to do their part and stay at home, with your loved ones and protect them as much as you can.
Yeah, and what about if folks want to get involved? Is there any way for folks to help out your members and help them as they do their job, or things that they can provide for you guys right now?
So we are trying to be a hub of resources. So if you know any type of resources that our members can utilize, we're collecting a website that we've started for them. If there are any any people that have any access, the number one request is for PPE. So if you have anybody that has access to masks or gloves or N95 masks or any gowns or any type of equipment, we are in, we strongly need that. We desperately need any type of connections that you may have. And I'll say there are a number of, elected officials and candidates that reached out to us and have provided some equipment for our members, and we are truly, truly thankful. It doesn't matter the quantity. If you can get your hands on any of that type of stuff, we strongly appreciate it. If there are, there are some hotels that have offered, rooms for healthcare workers, or Uber has offered rides and transportation to some of our members. So if you have any of those type of resources, we our members are in desperate need of them. And if you can connect with us and let us know about them, we would truly appreciate that, outside of just doing your part and staying home.
And Ricarra, what's the website? You said it's the website. Do you know?
Yeah, so it's the 1189 SEIU website is where we are collecting these resources for our members. But if you, I think you guys have the link to my Instagram, but if you have any resources, if you can drop them on my Instagram page, or even feel free to email me. It's Ricarra, RICARA.Jones@1199.org. So any type of resources that you have access to, or any donations that you're able to make, our members would truly appreciate them. And I do want to say, I do want to add that if you, that we also have a petition, which I'll share the link, where we're asking for more PPE. But I also want to let folks know that under the relief packages that were passed in federal legislation, healthcare workers are exempt from those. So if they need to be quarantined or take time off, they are not going to be covered. Unlike most of our other workers, they are exempt from those coverages. And if you work at an organization that has 500 or more employees, you're also exempt. So in these new packages and this new legislation, we are fighting very hard to get our members covered under that legislation, because they are on the front lines, and unfortunately we have members who have tested positive are going to need to take that time off. So we want to make sure they're covered. So we're contacting. If you can contact anyone that you know in Congress, if you can call your rep and just say, hey, we need to make sure that healthcare workers are covered, that would be a good helpful for us.
And we will definitely do that. So that means everybody on here, everyone in Baltimore, call Senator Cardin, call Senator Van Hollen, call Congressman Sarbanes. If you live where I live in Northeast Baltimore, call Congressman Rupersberger, and make sure that we're telling them we will need this in the package. And also, SEIU's website, we just dropped it in the chat, is 1199SEIU.org/Maryland_DC, so you can get more information about the great work that they do there. Ricarra, also wanted to see if there's anything else that you wanted to mention, uplift about your workers and the great work that you guys do. As a former union worker myself, I know about the great work, but there's anything else that you can talk about, especially with what we have with COVID and your members, and things that you might want people to know?
I mean, I just want to say, I think that this is a time, if you know a healthcare worker, thank a healthcare worker, right? Because they are literally putting their lives on the line to protect us all. And then just raise the fact that, there are other essential workers. Like when you go into a grocery store, if you go to Shoppers, those are UFCW members. Those are also union members. So, we didn't normally think of grocery workers as essential workers, but they are literally, also putting their lives on the line so that we can get the groceries that we need for our families and to feed our families. So if you know a healthcare worker, definitely, say thank you. And then for us also, I think a lot of people always acknowledge doctors and nurses, but there are a number of healthcare workers that come in contact with patients, right? So it's from dietary, the folks that make sure those folks are fed, EVS, that make sure the rooms are clean. So it's a whole gambit of titles and folks who are out here every day, away from their families, who are sometimes forced to go into situations where patients have tested positive, and then they have to go home to their families and take the risk of possibly infecting their families as well. But they're still out here because they know what's important, and they want to make sure that we are all cared for. So just always, if you have the ability to just appreciate the work that folks are doing, so that we're all able to sustain during this, this pandemic.
Thank you. Yes, and listen, we talk about this a lot. So, Ricardo, I want to say thank you to you and your workers. I want to say if anyone has any questions for us before we let our fabulous guests go, we know the tough work that they do each and every day on the front lines of this pandemic. That's why we invited Ricardo to come on and talk about that, but to also let us know how we can help advocate for them and stand up for them, so we make sure that they're getting everything that they need. And while I'm talking right now, also want to mention that we have a virtual taxpayers night coming up on Tuesday, April the 7th at 6 p.m. You can actually watch that live on Charm TV 25. It'll be streamed and done through WebEx as well, just like we're doing our council meetings and our Board of Estimates meeting. Our first digital council meeting is actually this upcoming Monday. We'll put all that information in the chat as well. Ricardo, I want to say thank you for joining us. Thank you for all your hard work that you do each and every day. Thank you to the wonderful members who are heroes, not just during COVID-19, but every day of every year for the tough work that they do that many people would not do. Thank you to all of them. Thank you for joining us. Make sure that we stay tuned, you guys, so how we'll be consistently talking about how we can help them, and then also giving you more information. And I'll be back again tomorrow. And on Sunday, we'll have a special guest, another special guest on Sunday. We'll be joined by we're not going to tell you who it is yet, but a Baltimorean who just happens to be an NFL player right now, who's going to join us on Sunday. So thank you, everybody. Thank you, Ricarra, and we will see you guys again tomorroure.
Sure.
Peace.
Thank you, President Scott. Thank you.